You find out that you've had thyroid cancer. Now what? Well, first, let's talk about the risk of dying from thyroid cancer, because it's very, very low. Less than 2%, probably closer to 1% of people will die from thyroid cancer over the lifetime. And most people, 98, 99%, will live a long, productive life with thyroid cancer, but having to go through the process of treatments, follow-up that is required. And I think it's just something that, in relationship to cancer, no one likes that word. But when we talk about it in relationship to the thyroid, it's not the death sentence that people talk about when it's related to other medical issues or other cancers. There are different classifications of thyroid nodules when they come back after a biopsy. And there's a classification that we call Bethesda 5, which is the suspicious for malignancy, and Bethesda 6, which is malignant. And so those classifications are obviously concerning and need some action. And depending upon a number of different variables, there are a number of different options. So for one of these nodules, if they are small, less than 1 centimeter, if they're located in a part of the thyroid which is amenable, they can have a procedure called radiofrequency ablation. That might be a possibility for one of these types of procedure possibilities. Another might be what we call active surveillance. Active surveillance means basically following the nodule size-wise and not necessarily operating on that. And you might say, well, who would do that? Well, it might be a situation where you have an individual who has a lot of other medical problems and they couldn't be operated on because those medical problems make it impossible to have an appropriate operation. Or they could be just someone who says, well, just don't have the wherewithal now, the time, the money, the whatever. There could be lots of different variables. Or they're scared of surgery more so than they're scared of this thyroid cancer, which probably has been there for a period of time, might be there for a long time, and might not change at all. So we're not doing something that isn't appropriate in these cases. We're just giving people options. But I would say that still the vast majority of patients who have a Bethesda 5 or 6 are going to have surgery of some type. And that surgery will depend upon a number of other variables. So the criteria for active surveillance is no extrathyroidal masses, no lymph node involvement, and not close to the trachea, the middle of the thyroid, because that might injure one of the nerves that goes under the thyroid and is the laryngeal nerve, and could have some concerns for vocal cord paralysis. So let's talk about why papillary thyroid cancer might be different from other cancers that you've heard of. And the first thing I'll say is that not all cancers are the same. There are many different types of cancer, many of which are much more aggressive than thyroid cancer. In fact, thyroid cancer is one of the least aggressive cancers that we have. And the reason is because when cancer becomes a very malignant entity where it's really causing problems, is it when it spreads throughout the body, or if they're in an organ that is vital to the body's function. In the sense of thyroid, we can always remove the thyroid and we can always replace the thyroid. So we have that going for us when it comes to thyroid cancers and thyroid cancer treatment. And the second thing is that thyroid cancer tends to stay locally. It tends to stay within the neck region and therefore doesn't tend to move as much into other parts of the body. So it doesn't have that metastatic component that many of the other cancers, which are much more aggressive and have much more significant consequences. Even though thyroid cancer is cancer, we want to look at it more like another disease, a manageable disease, one that can be treated, one that can be followed, one that doesn't have the huge impact on people's lives that other cancers might. And so we want to keep it sort of in a space where we feel like we can just treat it with all the methods that we have. And for the most part, although there's a lot of issues up front, surgery and sometimes other treatments, typically it becomes something that people live with and they go on throughout their life, and it becomes just part of their medical conditions.